Your surgeon has chosen to treat your pathology with an external fixator. An external fixator is a device worn outside the body that is mainly used to hold broken bones together, correct bone deformity, correct unequal limb length, or treat joint pathologies. There are different types of external fixators. The fixator is connected to the bone by pins. The pins pass through the skin and sometimes the muscles to connect the external fixator to the bone. Sometimes wires are used with pins or instead of pins to hold the bone pieces. The area where the pin meets the skin is called the pin site. The pin site must be kept clean to prevent infection. If the site becomes infected, the pin may loosen or may need to be removed. You will be shown while you are in the hospital how to clean your pin sites. This presentation shows you how to clean your pin sites at home. These are general guidelines only, and you should always follow the instructions of your surgeon. It is recommended to clean the pin sites once a day. Step 1. You will need the following cleaning supplies: sterile water or other cleansing solution recommended by your surgeon, disposable cups, sterile gauze dressing 5 cm by 5 cm and 10 cm by 10 cm, sterile cotton swabs, bag for waste disposal, paper towels. Step 2. Hand washing is the single most important factor in preventing infection. Wash your hands thoroughly, including between the fingers and the back of each hand. Only use soap that is reserved for you. Use a clean paper towel to dry your hands and throw it away after use. Don't touch anything else before starting the cleaning procedure, such as your wheelchair, crutches, or dressings. Step 3. Gently massage the skin around the pins with your fingertips to make sure that the skin is free to move slightly. This brings any drainage to the surface so that it may be cleaned away. Step 4. Pour the sterile water into the disposable cup. Then dip a sterile cotton swab in the sterile water. Start directly at the pin site and move the swab in a circular motion around the pin, making the circle larger as you move away from the pin site. Remove any drainage or crust that may have formed. Do not re-dip the cotton swab back in the solution. If the pin site needs further cleaning, use a new sterile cotton swab. Dry the pin site with a new cotton swab. Use a new sterile cotton swab for each pin site. Step 5. Clean the entire length of each pin with a new sterile swab or a 5 cm by 5 cm sterile gauze pad. Remember to use a new swab for each pin. Step 6. Wrap sterile gauze loosely around the pin site. If there are raw edges of gauze, roll them inside so that no loose filaments get into your pin sites. Place your fingers over the gauze and gently press down on the skin around the pin site. After the first few days, when the pin sites are dry, gauze should not be used. Instead, the pin sites should be left uncovered and exposed to the air. Step 7. You must also take care of your external fixator. The entire device should be cleaned using the cleansing solution, 10 cm by 10 cm gauze dressing and cotton swabs. Take care not to move the different elements of the fixator. Detergents with fluoride, chloride, bromide, iodide, or hydroxyl ions must not be used. Afterwards, dry the fixator thoroughly with a clean towel. Step 8. Place all materials used for cleaning into a bag for disposal. Wash and dry your hands thoroughly again. Your surgeon may allow you to shower with your external fixator approximately 10 days post-surgery. While in the shower, gently clean your external fixator. Afterwards, dry the fixator thoroughly with a clean towel. Continue to clean your pin sites as shown in this presentation. Even with excellent pin site care, there is a chance that pin sites may become infected or cause complications. Signs of infection are redness at the pin site, swelling at the pin site, thick or coloured discharge from the pin site, loosening or movement of the pin, persistent pain or soreness at the pin site. If you experience any of these signs, or if you have doubts on the pin site cleaning procedure, you should contact your surgeon's office immediately. If your surgeon has prescribed antibiotics to reduce the risk of infection, be sure to take them as instructed. Remember to clean your pin sites daily, even if you are taking an antibiotic.